All right, everybody, welcome one and all to our webinar, Collaboration for Change, a Law Enforcement and COC Care Coordination Model. We are going to begin in just a little bit as we admit everyone from the lobby. Expect a few folks to show up over the next couple minutes as well. So thanks for joining us. I'm going to go ahead and kick us off. I am John Blackham. I work for Ecovia's marketing team, and we are delighted to have with us representatives of the city of Topeka, both with the city as well as the police department with the behavioral health unit. And go ahead and flash forward to the next slide so we have a chance to introduce ourselves. We have with us Carrie Higgins, Hillary Lopez Foster, Sergeant Matt Rose, and Officer Robert Razzo. Do you want to do a quick 1-minute introduction of yourselves?
Yes, so my name is Carrie Higgins. I am the Housing Division Director for the City of Topeka, as well as the COC lead for our area.
I'm Hillary Lopez Foster. I am the EAS Program Coordinator and COC lead for the City of Topeka.
I'm Sergeant Matt Rose. I've been with the Topeka Police Department for 13 years. I supervise the Behavioral Health Unit, Crisis Intervention, and Homeless Outreach teams.
I'm Officer Razzo. I've been with the Police Department for about 22 years now. I've worked underneath the Behavioral Health Unit and do the Homeless Outreach. And Sergeant Rose is my boss. Thanks.
Awesome. Thank you so much. Throughout the presentation, if you have any questions, we definitely welcome those. We're going to have a Q&A section at the end. So as questions may occur to you, things you would like answered, any clarifications, go ahead and submit them in the Q&A tab, which you can see up on top. There's a chat, Q&A, React, all those tabs. So you can submit them in the Q&A tab. We'll also be checking the chat tab in case you submit those through chat as well. And at the end, we'll be addressing all of those. So feel free to ask those questions. And with that, I think I'm going to go ahead and turn the time over to you.
Sounds good. We'll just go ahead and go to the next slide there, John. All right, things we're going to cover today. We're going to go over the background of all of our programs and how we started working together. We're going to touch more on that in collaborations, as well as how the police department and the COCs work together. And then along with our other community partners that couldn't be here with us today because there's just not enough room on our screen. Then we'll go through, Officer Razzo and Hillary will go over how they were able to build out Client Track to better suit their needs in the field. And then lastly, we're going to touch on lessons learned, things you guys can do in your own communities to start and try to get to our level of cooperation. Hopefully we can start spreading the way we do business.
So, for myself, since Homeless Outreach teams, our main focus here is basically the City of Topeka and the Police Department has their outreach team. However, we also have nonprofit organizations that also assist us. The main two focused ones would be Vallejo, our behavioral health, a local facility that we have here, and then also the Rescue Mission, who helps the homeless community and shelter them as needed. However, there's other nonprofit organizations that are wanting to begin this program, their outreach team. So that whole coordination piece is going to start developing as well to get more partnerships together and more teams to help us out with the community.
One of the things we wanted to touch on today was the Mobile Access Partnership. I don't expect any of you to know what that means, so I'll explain it real quick. The Mobile Access Partnership is honestly how we've been able to be successful in any of this. And what it is all of our local providers meet together every Tuesday and Thursday. We have a shower trailer, mobile clinic. We also have a mobile veterinary service that comes out to take care of homeless animals as well. A cell phone provider is on site. And so all of the people in our homeless community can come to this one place. It travels around town every Tuesday and Thursday. They come there, they take the shower, they get fresh clothes, they get engaged with services, whether it's through Vallejo, through mental health services, Stormont Vale, our local hospital, for medical care, or Dr. Crow and the Street Dog Coalition for care for their animals. And it gives us a really good opportunity to network with all of those providers. But most importantly, it gives us an opportunity to sit down with the people that we're trying to serve and better understand what it is that they need and how they need it delivered. So without Mobile Access Partnership, we would be well behind the 8 ball right now.
So the City of Topeka is the Topeka and Shawnee County Continuum of Care lead, which is a bit unusual in some circumstances. Oftentimes you'll see the COC lead being a nonprofit or social service agency. So we are the government and we are the COC lead, which definitely has benefits in some ways. We receive HUD funding, so it works well that we are also the lead. It can be challenging in other ways in that we are a government entity versus a nonprofit, so it can create its own challenges. But as the COC lead, we wanted to create a coordinated entry system that would make access to rent assistance in our community easier. Previously, anyone that needed assistance would need to call 6 to 7 different agencies. They're all small nonprofits, so they would have different schedules. Some you would call Wednesday morning during 9 to 10 a.m. to see if you could get help. So it was challenging for individuals who were already in crisis. We're asking them to jump through so many more hoops to try to get assistance. So out of that came the launch of our program. We call it EAS for short. It stands for Equity Access Shelter. And that is a single access point for anyone that needs rent assistance in our community. So it makes it easier to access. It brings equity back into the picture. It's no longer who gets lucky and happens to get through during that hour that they're open to receive phone calls. It also allows us to do an assessment with every individual that needs assistance. So we're able to pull names based on their score. Their score is going to tell us their level of crisis so that we're able to assist those that are in the most need first and foremost. And then out of the EAS program is where we really started to see a need for better outreach data, better encampment data. We already were collaborating well with our partner agencies through the outreach teams, through the MAP program, through EAS, but we still saw a gap in some areas where we could partner together better and also be able to track and gather more specific data that would benefit us as well. And next slide, please.
So I'm going to take a second to talk about my bread and butter. Why do we have a behavioral health unit? So to tell you that story, I got to tell you this story. In 2007, we had an unfortunate incident here in Topeka where there was an officer-involved shooting involving a citizen who had severe mental health needs. And as a result of that incident, we really needed to take a step back and look at ourselves and figure out what it was that we could have done better to prevent that from happening. And we narrowed it down to, it was generally a lack of education about how to deal with citizens in our community suffering from mental illness, and that we were ill prepared to address those. So like I said, that occurred in 2007. That's when we started just our crisis intervention team. Over the years, that morphed into the behavioral health unit to address more specialized needs in our community. And now we cover crisis intervention, behavioral health, and homeless outreach because there's a lot of crossover in those communities. Is one of the things that we've noticed. In 2007, when we started the program, it was really just an officer on the street that was being dispatched to a mental health call, and he would request a co-responder from Vallejo, a master's level social worker, to come out and assist them with the call. We were finding that by the time that co-responder got on scene, the crisis, which we all know is very short-lived, was already extended well beyond anything that the social worker was going to be able to help us with, or the officer was already able to de-escalate it. And so we were just wasting time. So in 2013, we changed the model, and now we run on a co-responder model, whereas the social worker is paired with one of my officers every day. They are a team on first shift and second shift. Unfortunately, not the manpower for third shift or weekends right now, but first shift and second shift, they handle the majority of calls. Also, every officer working the street today in Topeka has gone through the 40-hour crisis intervention training. That's part of our academy now. So there's ways to address that. So what is the behavioral health unit as it is in practice here in Topeka? It is the crisis intervention team, like I just mentioned, those co-responder teams going out, handling most of our mental health calls for service. What they are not able to respond to, officers on the street are much better prepared to handle. They de-escalate the situation, take care of it non-violently, and hopefully without an arrest. Our main goal of the program is diversion from jail and other high-cost resources. You're not going to get the mental health treatment that you need while you're incarcerated. So if they handle it enough to de-escalate the situation, then they'll send my team an email to follow up whenever they're back on shift, and we'll go out and do one-on-one meetings with those clients. We brought in homeless outreach. That's spearheaded by Officer Razzo. He goes down into the camps. We both go down into the camps, build personal relationships with the people we're there to serve. Typically, most people in those situations would not enjoy seeing a cop show up. But we've been able to take the time and given the latitude by our leadership to allow us the ability to do that. We go down into those camps and we build personal relationships, actual friendships, figure out what they need, build that trust level so that whenever they do decide that they're ready for mental health treatment or detox treatment, it's us they come to send us in that direction. Ultimately, the whole goal of my unit is to, one, as far as people that are concerned about the budget, to reduce our dependency on high-cost resources and then break down those barriers and the stigma. When my officers are on the street, they're dressed like we are. I know you can't see my lower half, but we all wear these black polos and khaki pants. We drive unmarked cars. They're silver Ford Explorers with no light bars. We don't look like cops when we show up, and the one thing has done so much as far as reducing the stigma whenever we pull up in front of somebody's house. We got away from our black Explorers because the government drives black cars, and some of those delusions center around that. So it's all really about focusing on what people's needs and concerns are, and then finding ways to combat those. Very proud of my unit. Next slide, please.
So here, this is where we really start working with the different teams and how we develop the homeless shelter, the mental health providers. Those are the key things that we have. However, there are, like I stated before, there are other nonprofit organizations that help within the community, such as the social services agencies, the hospitals, churches, community care, and local veterinarians that do help this as well to support our main focus and our goals that we have. The idea, is the interaction between each other, being able to communicate with each other and provide the services that are needed and try to do it effectively as we can. One program that I also work with is the City ID program. What this entails that when in the homeless community, they have nowhere to store their personal information, such as their social security card or the birth certificate, and mainly they just don't have it or lost it some years late before. However, they don't have any identification, and one needs the other. So if you need some type of your state or Kansas state ID to get your social security card, to get your birth certificate, we've found a way to utilize the state to help us start a program. So what I do is I use databases that identify these individuals. And so once I have these individuals ID'd, I produce a city ID card that has all of their pedigree on it, and to include that their Kansas ID or their state ID that they last had one at is on there. And that verifies them to get a state ID, which takes not that long. When I first started the program, my understanding was that prior to me, before I got handed over, it took anywhere from 3 weeks to sometimes 2 months to just actually produce the city ID. And that's just because of manpower issues and other stuff that fell on our shoulders that we had to do as a unit. With technology and everything, and speaking to Sergeant Rose and how we can expand this and make it more efficient and less time consuming, we were able to get some software programs and then dedicate myself to develop the way that it's going to be presented, and then that I can do it on the spot. Now it's mobile. We're able to take pictures on site. Also, I collaborated with the agencies that go out, Vallejo, EAS as well, as Hillary works side by side when she's out there doing the outreach, and TRM. They're able to fill out the applications. They're able to take the pictures, send it to me, and I can develop the city ID. Now, the city ID is good for 1 year. Within that year, they can always get one, but with the way we programmed, it's 1 year for that city ID to go get the state ID. So that has that verification. They have that state ID for 1 year, And then within that year, then they'll get all the federal documentation that they need to produce a permanent Kansas state ID. So that helps out a lot. And then they're able to get their information. And then for us in Kansas, the state of Kansas, it's 6 years that they have that permanent ID. Other than that, we also go out there and just do the outreaches with everybody working the MAP program.
Go to the next slide, Joe. Okay, so here's a pretty picture for those that like pictures. Really what this is a breakdown of how all these different agencies within our city work with the HMIS system that Officer Razzo and Hillary have partnered with Ecovia on building out for our needs. So all of these lines are two-way roads. So we input information as law enforcement, we pull information back out. It's important to note, for those keeping notes at home, that as law enforcement, the law enforcement people that are actually accessing this program is Officer Razzo and I, and no one else. So that information stays protected. It's not used for any enforcement actions at all. It is used solely for the purposes of helping people through their, sorry, I lost my slides, but it's solely for the purpose of helping people through their issues, whether they're going to detox services or they need a city ID or anything like that. Next, hospitals are pulling information in and out of that system so they can keep track of their frequent flyers, and they can loop in the rest of the social service agencies on what needs some person might have that we weren't already aware of. John, did we lose you? Okay, good. All right, so next thing, we have the homeless shelter. They're inputting and pulling information from there, looking for, again, frequent flyers, people that are staying inside the mission at the time. Really helps us save time on who's going out on the street and looking for certain people, if we can just access Client Track and figure out exactly where they are. Our local mental health providers are also checking and inputting information into that system. Again, mainly all of this is to keep track of our frequent flyers, so we can keep eyes on them and figure out where they're at in the process so nobody falls through those cracks. And lastly, but certainly not least, is housing services. So they're inputting all their EAS information in there so that we can get people off the street and start to break their cycle of homelessness. I just really wanted to spell out and show everybody how all this information looks in a graphic instead of me just telling you about it. But the partnership in Topeka goes beyond just the people in this room.
Yeah, so we have all of these collaborations and partnerships are fantastic. As we mentioned earlier, we still saw a gap with the encampment and outreach specific data, and that is where we looked to Client Track and Ecovia to figure out how we could customize the system for our specific community needs. And so we really started working together with the behavioral health unit and ourselves as the COC lead to sit down and look at what are we missing as far as the data that can help all of these different partnerships and collaborations, because we already had a lot of great services in our community, but figuring out how to better collaborate and how to better gather some of that specific data that pertains to the unsheltered population was a piece we were missing. And so that is where the mobile readiness piece came from. John, you can flip to the next slide, please. Thank you. So that is where we call it mobile readiness. That is where the COC leads, Hillary, and the BHU unit, Officer Razzo, started partnering with Ecovia to figure out what we could do to customize the system for our needs. And we call that our mobile readiness system. And I will let Hillary, you share a little bit about that.
So with that being said, we needed to start tracking those migration patterns of the homeless, especially because they lose out on vouchers or housing because, you know, we've lost contact with them. You know, we just don't know where they're at. And, you know, if you reach out, so this brought it all to right then and now. So any team, outreach team, can go in here and it's live data. So we know exactly where they're at. We can go out there. We can say, hey, we've been trying to get a hold of you. Also send out those partnering agencies that may need to outreach them while we're there.
Yeah, I know Sergeant Rose talked a little bit about the protecting the sensitive client information. I think that's a really important piece, especially as this was the first time that we were adding law enforcement to the system. And for some of our partner agencies, there was some concern about the safety of the data or what exactly would that information be used for. And so part of our building out the mobile readiness piece was looking at best practices across the state of Kansas, really across the country, looking at other COCs in our region to see what they had done, working with HUD as well. And it was really as easy as modifying some of our user agreements, some of our forms and guidelines, so that we have a clause in that user agreement that specifically says law enforcement is only able to use the information to assist individuals. They're not allowed to use it for any sort of law enforcement type purposes. And that gave a sense of security to our other partner agencies that the data that the law enforcement individuals would have access to wouldn't be used in a way that we didn't want it to be used for. Part of that was Ecovia has some great features that allowed us to set up separate work groups. So the work group for the mobile readiness piece, which is the piece that just does the outreach and encampment specific data, it is only accessed by certain individuals who need access to that information. So that is another way that the data is protected. We also can access the type of information and the roles even within that group, so that we're ensuring just those that need the information and different types of information have access to it. The other piece of that is we put into place sort of a two-layer security system on our end, as far as we normally would have our HMIS administrator approve first level approval of anyone that needed access to ClientTrack and that work group specifically, and then it would go to myself as the director to give final approval. In the case of the mobile readiness piece, we added another layer where Sergeant Rose, as head of the behavioral health unit, also signs off on any access to that group as well. Just again to ensure that we're protecting the data. Also, we're building that trust with our partner agencies. I think that's super important, and these type of collaborations is a willingness to work with the partner agencies, ensure that they feel safe with the way we go about things, and just building that rapport with them as well.
So one of the things you need to be concerned about any government agency doing anything like this is whatever your state is, insert that now, and then the Open Records Act for that area. Because working for a government entity, police department, city of Topeka, doesn't really matter which, you're subject to open records requests. And so one of the things we absolutely cannot risk happening is information, sensitive information about the homeless population in this city and their exact location on where they're camping. I'm sure all of you can imagine about 1 million different horror stories that might develop into. One of just, not everybody in this city, and I'm sure your own cities as well, is super pumped about homeless people in general. They catch a lot of flack. Whether you feel like they deserve it or not, it is irrelevant. But what we can't have is people that are disgruntled with the homeless population showing up at specific camps, harassing people, because that is absolutely counterproductive to change in their cycle of homelessness and increasing their vision of self-worth. I like to tell people all the time, it's not true, but I like to say it, that we're not real cops. We absolutely are real cops, but we operate a lot differently than your standard patrol officer. We have the latitude not to, if we walk into a camp and I see somebody using drugs, I don't have to make an arrest. I just respectfully request that they don't do that when I'm around. But that also goes a long way with help building that rapport, as well as building rapport with our other partnering agencies to know that the information they're inputting into ClientTrack is safe with Razo and I, that we have no desire or no willingness to help people go out and find low-level warrants or misdemeanor crimes or anything along those lines. I'm not going to give you the camp information for that. And we don't give them access to Client Track to get that for themselves. You just really need to be able to trust the people that you have in place. You can't take your standard patrol officer and put them in our position and say, now I need you to safeguard these people. They actually have to care about the human element involved in this and have to want to see people do better on their own.
Yeah, I think that's so important to talk about, because if you don't have some type of behavioral health unit, that is what makes this collaboration possible, not only with the COC, but with all the other partner agencies as well, the social service agencies, the local rescue mission, because their approach is just very different. Their approach is, how can we help these individuals? How can we kind of be the mediator, even sometimes between law enforcement and the COC? And that is a huge distinction that really is key to making this partnership work.
Fortunately, because HUD is federally mandated and we have Client Track built out the way it is underneath HUD, everything we do within Client Track is not subject to an open records request. So we are able to shield all the information that is inputted by ourselves and our community partners within that program. And so that's how we're able to protect that information and keep them with their peace of mind that all of it is safe.
Mm-hmm. Yeah, I'll add that there was, as we were partnering with the agencies, talk of what system will we use. Of course, us as a COC, we already used Client Track and the HMIS system, so that was our push to just customize what we needed and use that versus a different system. And part of that is because of those security factors. We did have an instance where someone was asking for permission to access to the mobile readiness piece, specifically to find camp locations in order to serve warrants. And the system's protected, so that was an easy, nope, you absolutely cannot have access to that. And that put a stop to it right then and there. So using Client Track for this purpose has been very beneficial for us in many ways. Next.
Yes. That's fair.
So,
Sorry, we'll get it figured out. For a second.
So with the enhanced care coordination, this resulted in us collecting specific data. So what we do is when we go out to that encampment, we identify how many people are at the encampment. We actually do get their names, but we, on a separate encampment part of that, we put how many individuals, how many structures, whether there's biological concerns, if there's animals and like their nature of aggression. This is everything that we are collecting, plus then any of the services that we are giving, as well as the community outreach teams. Because, you know, we want to stop the deduplication of services within the community. So then also with that being said, we are able to map these through our GIS, Google Maps, and we are tracking the migration, especially with current situations that are happening here within our city. And we definitely need to know where they're at, especially if we're going to get them housed, especially with those voucher programs, Shelter Plus Care being one. So if that person makes contact with them while they're out in the field, they can say, hey, I located so-and-so and this is where they're at. So then we go in, Officer Razzo and I, and kind of clean up that data as well to ensure everybody is where they're supposed to be. This does improve the data quality as well. For the simple fact is it's given us better data. This is going to show what needs are truly needed in the community, where the focus needs to switch to, things like that, where our funding may need to switch. Do we need to look at affordable housing, or, you know, or do we need to say, hey, we're having homeless prevention, we need to prevent them from being homeless, stuff like that.
I think one of the biggest pieces of the improving the quality of data is that everybody that goes to a camp, because we have multiple different outreach teams within the city, and we're not going to all of the camps ourselves. A lot of time that job is handed back and forth multiple times on whoever has time to go out to see a specific person on that day. So improving the quality of data really comes from standardizing the data that's entered into the system. You have boxes that you need to fill out whenever you go there, and it's across the board the same for every agency. So whenever you access that client's jacket, you're going to see the information that you're expecting to see there every time. Nobody's leaving those boxes unfilled, or at least they better not, but they got an answer for it. But that way we know exactly the information we're going to pull from that, and we're able to control what that information is. Down to, I think, probably the most important factor is being able to input specifically a grid coordinate. They don't have a mailbox to read their address off of. So knowing exactly where they are in the world with an 8-digit grid coordinate is invaluable. Being able to enter that information into their jacket is awesome. And I'd like to take just one quick second that it gets scary for a lot of people when the government starts using the word tracking. Whenever you hear the word tracking in this presentation or anything as far as the way client track is used in this city, think of it more as coordination and knowing where people are so we can provide those services to them. We're not staring at our computer screens watching a GPS beacon that's attached to their foot wherever they're moving. It's really just deconflicting with our partnering agencies and knowing where people are so we're not wasting time trying to find them again.
And so that no one gets left behind. So
Yes.
previously, before this mobile readiness version, what was happening was we would pull someone's name for a rapid rehousing voucher, but we couldn't find them. And so we would lose out on being able to get them that information and get them into housing because we didn't have their specific location. And so when we say tracking, it's just having an idea of where their last camp was, or if they've moved, we have that data in the system so that we can find them quickly, and we can get them into services in a timely manner as well so that they're not losing out. And it really helps us to make sure that no one's left behind.
We know it's a bad word. Please know we don't use it in that phrase.
I think that what also is good to mention is that we currently still, but prior to this and building this out, is that we would have monthly meetings, and we still have monthly meetings with all the partnerships that are involved. But yet the problem is with that is that when one of my outreach teams are getting the information, and by the time it gets to us in the meeting a month later, then that's an issue, right? So we have to have that information as in time motion so that they're able to put that in there. Everybody can see what's going on. We'll still come up with trends or whatever that is needed within those monthly meetings, but the data needs to be fresh and current so that we know every time that they're moving or relocating, or what services that was provided, and also that we're not duplicating that service as well, so that we can have available resources for everybody within the homeless community.
So let's talk about real quick, how does Client Track help us broaden the reach of our community programs? We have several real life examples of how that's useful in our city and people accessing Client Track to deconflict and make those initiatives happen. So Razo, you heard him talk a little bit ago about the City ID program. Initially, City ID applications were only done at the police station on Thursdays between 3 and 5 p.m. by a select group of volunteers in our community. And that was the only time somebody had to come in from the street into the police station. If you can imagine, a lot of people don't want to do that, to fill out an application, get their picture taken, trust in us that we weren't going to use that information to run them for warrants, just so they could get a City ID. But since we've started using Client Track and we're able to send Officer Razo out to specific camps to do it, or to send other social service agencies out to those camps, they take the application, they take the photo, they send that information back to Razo, and they meet them where they are. And I think in most of our homeless outreach activities, meeting them where they are is the most important factor. I think we'll get into that a little bit more in a little bit. As far as KDHE, the Kansas Department of Health and Environment, they're able to use Client Track to help deconflict and send out syphilis vaccines, the COVID vaccine when that was coming around, making sure we're keeping track of people during extremely hot weather days, making sure they have enough water to stay cool, making sure we know where people are whenever we have a massive cold snap. We need to go pick them up and bring them into a warming center. Like, all of these things were not possible without driving around aimlessly trying to find people before client track. You either had to have everybody in the room that touched each specific camp to know exactly where everybody was, and hopefully they talked to them recently so that you knew where they moved to. Now we're able to just access the information at one central point, and you know everything that everybody else knows at the exact moment that you need it. Really being able to take those community programs and reach deep into the community, send the programs to the people, has done more for building our rapport in the homeless population than any amount of shaking hands and giving hugs.
Yeah, that's been huge. And as we have with our partner agencies and our collaborations, and then building out this mobile readiness piece with them, the cool thing is that these collaborations continue to just grow and expand. So, I mean, we're continually having new groups or new agencies want to come on board, want to be part of the outreach teams and get some of their programs out into the community where the people are at. And so it's been great, and it just seems to continue to grow and get better as well as time goes on.
Great. Next slide, please.
Okay, so the encampment management, we have those outreach teams. They, again, enter that information into our encampment work group, which we've named the Capital City Collaborative Outreach Teams. And so then when they are out there with that individual, they can drop their pin, or they can even tie it to the service that they're giving to that client. And then it, like I said, then it drops that pin and it gives them a geolocation, and they can put that into the system. So then that way, when another outreach team pulls them up, then they'll see, oh, they've already been out here today, so I'm not going to go out there again. You know, that's the one good thing about it, is that it allows us not to, like Razzo said, Officer Razzo said, is it allows us not to deduplicate services, and we can take that service to another person that is maybe in crisis as well. So
we also added camp-specific needs, and there's a safety piece of this as well. So are there safety issues for the outreach workers? Do they have aggressive animals? Does the individual at the camp have a history of trauma and prefers to work with a female outreach worker? All of those things can be noted. Are there biohazards? Are there safety issues? All of that. We created all of that into the mobile readiness so that we can have that information and track all of that as well.
yeah, so that way an outreach team is not going blindly into that camp, and they know that the individual may not respond well if a male or a female, depending on the individual, comes to that encampment. So then they can send and reach out to another team to have them come out and reach out to them.
Or maybe there's just enough red flags on that camp they don't really want to go into without Razzo or I present.
Yep.
Whether it's an aggressive dog, like just being able to mark the animal that lives in the camp, and you can mark the animal that lives in the camp by name. So the veterinarian that goes out to help treat those animals knows exactly where to find them, how many are there. If they're aggressive or not, well, you certainly want to know that. If they're aggressive, are they on a chain usually, or no? Do you need to stay in your car and kind of haul it from there? Just a bunch of different things to keep all of our outreach workers safe, because Officer Razzo and I are just two people. We can't be with them all of the time, every time, if there's a safety concern. We really put a lot of trust in our other outreach teams, outreach programs, community partners, to look at those notices and make an educated decision on whether or not that's a camp they want to go into without support.
So I'm also not only with the police department, but I'm also a captain in the Kansas Army National Guard. So that my background with them here currently is a knowledge management officer. When Hillary and I got the assignment for the encampment management part and how to build this out. So with my background in knowing knowledge, and knowledge is important, that's what all this information is for. We just came up with scenarios and how does this work? My experience as an officer with the police department, as the knowledge management piece coming out of IT, and then with Hillary's experience with EAS and all the funding that's available for this program, how does this work? How do we document all this stuff, and what things do we need to put in there? We just currently talked about how, so on the ID portion, as I stated before, that there's a piece in there for the Kansas ID stuff, where you actually have the ID number from Kansas, or a driver's license number as well, that we're going to start putting that input and that information in there so that the people can see that they have a Kansas ID, they're part of this program, or where they're at within the program of the city ID. So that's also developing. So this is always ever developing, and then new ideas came up. And is it necessary? Do we need this information? Since you're working with so many organizations within that piece, what specific needs for that organization? What do they need that can be in one place and one centralized, that everybody's involved? So those are things that you need to understand of what's needed and what is too much information.
You know, Officer Razzo and Hillary have done a great job building that out. I think they submit changes to Adobe probably weekly to change the information that we're collecting. And like you said, we've removed things that we really don't want or need in there, and then we've added things that we definitely think are necessary. So why do you want to pay for it? And so really for us, I know for a fact that using this program to its utmost ability in the way that we've been able to field it has absolutely saved a lot more money than it's costing us to have it. And so the way it does that is resource management. I have a very finite budget that I can use to buy tarps and tents and boots and blankets and cases of water. And so if I'm not duplicating effort, that maybe Vallejo already went to that camp and delivered water today, and I don't need to. Maybe I can just stop in and check. Maybe Vallejo's out of tarps, and so they'll post in there, they'll put a flag on the camp that, hey, this camp needs a tarp if anybody's got one. We can go out and deliver one of ours. Workload duplication, we really don't want people going to the same camp over and over and over again throughout the course of a day. They do get annoyed by our presence sometimes, and if you constantly harass them, they're not able to do the things they want to do. They're going to get frustrated with all outreach teams, not just the one. In deconfliction, really making sure that people know ahead of time before they go into that camp what they're walking into. If they don't like the law enforcement at all, and surprisingly, I know that's not what you're expecting to hear. Some people don't want to see Razzo or I even in our current roles, and then that's fine. We're always working on the back end for them, but they don't necessarily need to see us doing that. If they don't want us there and it makes them uncomfortable. Some people in our community don't like Vallejo or the stigma that mental health treatment has on it. Some people don't like TRM because they have strict rules on letting people into the mission. Maybe they've gotten kicked out before and they don't want to talk to their outreach team either. So really having all that information, being able to deconflict who's showing up, when they're showing up, and how they're showing up is a huge money saver as far as just sending resources out, even just paying salaries on those people to go out to those camps.
And ClientTrack gives us factual information and data that allows us to counter some of the stereotypes in the community. So we hear all kinds of crazy things about the camps are here, or they're there, or they're from out of town, or they're not. And having that data that we're tracking on a regular basis allows us to sort of set the record straight and really put out factual data to sort of balance out some of the other stuff that's out there in the community as well. Next. Okay, so what are some of the lessons that we've learned? What would be our advice to you if you're wanting to set up some sort of collaboration or partnership like this, or customize your HMIS system to be more specific for whatever your community needs? So the first would be take the time to see the issues at hand from other people's perspectives and your other partner agencies' perspectives. I think this is so important because we all have the same goal. We all are doing this work because we have a heart for it. And so taking the time to really look at things from each other's perspective and knowing those things makes a big difference.
And so as to the reasons for homelessness are multifaceted. As we all know, it can be any reason. It can be from substance abuse. It can be from a financial issue that they had. A lot of people were going of as in your community where they lost their home because of when COVID was going on, not working, or what have you, or not family to support them. Some choose to be out there. Whatever the reason is, just understand that the approach may be different for everybody. It's not a clear cut, how do I do this with this individual? It's going to be different. It may look like the same, but it's always going to be different. And to have the ability to be diverse and understand the humanity of everybody, it's going to be work wonders.
So leaning on your partnering agencies, the collaborations will bring more about more change. That is a big thing, because there are maybe programs that you don't know about, but another organization does. And so, you know, if you lean on those organizations, then it's going to bring you more information and more services and more change to that person, that they're like, hey, I didn't know that was out there. Thank you for letting me know. Prime example, I was just out the other day. They didn't realize that we have a program for landlords for retaliation. So I said, hey, I'll bring you out that information today, and you can get in contact with KSL and start on that process. So there is that. Partnering agencies are a big part of what we do.
Next, you want to stay person-centered. You're going to meet each person where they are physically and emotionally. What I mean by that is every person's going to take a different approach. Sometimes you have to change the language that you use to be able to relate to somebody. But as long as you're doing the person first and not going in there with preconceived notions or judgments based on how they're living or the trash they have around their camp, or maybe you just don't get along with them on a personal level, that's fine. What you really need to do is be on their level. Use the language they use, relate to them as much as you're able to. So if they trust you, they are more apt to listen to the advice you have to give them.
And the fifth one is to be compassionate and empathetic to build genuine relationships. So I think our goal is to make sure that every single person that we connect with feels heard and cared for. And we do that by partnering with our agencies to share resources, share data. And for us, all of that is brought together by using the client track system. It makes communication easier, and it allows us to track all of that. Next, John. And we would be happy to answer any questions you might have.
Awesome. Yeah. Thank you guys so much for your presentation. It was awesome, and we learned a ton. And we're going to go through, thank you all, attendees, for your awesome questions. We're going to go through and ask those to our awesome panel here. So, and for things that were specific to, Ecovia or Client Track about like our software, we do have Mark in the chat who has been addressing those specific questions. And then let's go through and ask, first of all, I'm curious how you have been able to gain access to HMIS as law enforcement. Who wants to take that?
Yeah, so the City of Topeka is the COC lead. So we're the COC lead. We also are the HMIS lead. So we manage the homeless information system as well. And we manage and are the lead for our coordinated entry system, which we call EAS. So as we started partnering together and working together, we started having those discussions on how beneficial it would be for them to be a part of that, what that would look like, how would we do the security piece of it, and then taking that to specifically outreach and encampment data and building out part of our system for our specific community needs. So as the HMIS lead, we just made that decision to add law enforcement under those sort of specific conditions as far as what they're allowed to access.
Awesome. Thank you. Our next question was what software you're using. That's easy enough for us to say. That's Client Track, which is our case management software. And Bryce mentioned that. Thank you, Bryce, for that. And then did you all create an MOU with the COC to agree on how you will or won't use the HMIS data?
We do. We have MOUs in place, and then before anyone is allowed access to the Client Track system, there's a release form that they sign, and they are required to go through training with our HMIS lead before they have access to anything.
Awesome. Thank you. The next was more specific to the software. Oh, and by the way, this whole recording will be made available as well as the slides afterwards. So just the question and answers will be part of this as well. So that's important to note. Do clients know that their info is accessible to the police? Can they opt out of that component of data sharing if they choose to? And here we had Mark answer us with some specific stuff about how that works with the client track security model. They are able to have work groups set up so that they can also contain extensive security setup to where different departments would only need information that pertains to their role. Often HMIS and co-responder outreach can go hand in hand, and this allows easier coordination for services and referrals. There are numerous security and data sharing methods in place to better serve the client while protecting their data. Next question we have is, how does the rapid rehousing voucher work?
Yeah, so for the City of Topeka, our EAS program, which is our coordinated entry program, all of the rent funding in the community runs through that. So several of our different social service agencies receive HESG funding. It's Earth Emergency Solutions grants from the federal government. And they are able to pay, usually it's up to 6 months of rent and deposit for an individual who is homeless and looking to get into housing. And so through our EAS system, as an agency has funding, they let us know. We pull their name based on their score, and then we send it to the agency, who then meets with the client, does all of the intake paperwork, and helps them get into that housing.
Awesome, thanks. And I heard the key word related to the next question. How is this collaboration funded?
Poorly. No, it's funded by all of our community partners separately. As far as the City of Topeka pays for client track, they kick in some money back and forth. It gets very convoluted, but honestly, in our infancy, we really haven't expanded much beyond that into grants or anything. We pull from our finite budgets and just make it work with manpower and a can-do attitude. I really don't know how else to phrase that. Like
Yeah.
Well, and the thing is that we have such strong partnerships with other agencies. Their budgets come into play as well, because they're paying for a piece of the different partnerships as well. So having those strong partnerships and collaborations makes a difference as well.
Wonderful, thank you. Next question, how many outreach teams do you all have?
So, Lord, help me understand. So there are, the police department has one, Vallejo has another. It's the mental health provider in town. Sorry, I forget that not everybody's local, my bad. Then the rescue mission, they have another. Then you have another one through the Salvation Army, another one through Doorstep, another one through Catholic Charities. And I know I'm going to continue going, and I'm going to end up forgetting somebody that means a lot to me. So don't let me do that. There's just a lot of us. And being able to all of us work together is invaluable. And Client Track makes that possible for sure.
Thank you. Okay, how many people are in your encampments? 100, 500, etc.?
500 plus. As anybody that works in the homeless community knows, getting an accurate count is extremely difficult. In fact, good timing on your question. We just did a point in time count yesterday. As most of you know, the government mandates that point in time counts are done in February, which doesn't make any sense to any of us, because it's so cold. Most people are moving into like abandoned houses or moving to couches and things along those lines. So we opted to do our own point in time count in the summer as well to kind of see how those numbers match up. And we don't have the results back. Obviously, that was just yesterday. The winter point in time count, we should be right around 500 plus, 500 to maybe 600 max.
Awesome, thanks. Next up, can you provide more information about city IDs? Does this assist individuals with obtaining additional documentation such as SSC, BC, in-state, and out-of-state?
Yes, it does. So what we do is the city ID is just a temporary ID. The law enforcement has looked into their system. They have verified you are who they say you are. We're just raising our right hand whenever we give them that city ID that I can swear and affirm you're telling the truth. Then they take that city ID, they go to the DMV. Of course, all of this has to work hand in hand with your state. They get their temporary 1-year state ID. And then from there, that state ID looks just like mine. It just has an expiration date that's 1 year out. They take that ID, they go to the Social Security office, they go to Department of Vital Statistics, and they get their Social Security card and their birth certificate. They're able to prove residency, so they can take all of those things in and get their full 6-year ID and take care of anything else they need to. If they're from out of state and they've moved here permanently, we'll definitely help them out. We've helped other people out from other communities that they just didn't have anything in their city that could help them. So we've had caseworkers bringing people into town to drop them off and help them fill out applications, and then bringing them back to go to the DMV, and then bringing them back again to pick up the ID. And we've answered that question about how we were able to do that program as well to multiple different agencies across almost every state union. That program is amazing. And if it wasn't for the state DMV being able to do what they do with that information and taking us at our word, we've helped so many people get jobs and housing and just back on their feet with that.
Yeah, as you can imagine, prior to our City ID program, it was this vicious cycle. So it's hard to get housing, it's hard to get a job, it's hard to do all these different things if you don't have any sort of ID. To get an ID, you have to have a birth certificate and Social Security card. Well, guess what? You can't get a birth certificate or a Social Security card if you don't have an ID. You're literally just stuck in limbo, and it makes it really hard to do anything without being able to get that ID or the other documents. And so the City ID was created out of that and allows those individuals to be able to get their ID, to be able to get the other documents, so that then they can start moving forward with employment, with housing, with other services.
Also with the City ID, one thing that I have worked with is Reese's, which is our local food, one of our food establishments that make burritos and stuff like that. I was able to work with their HR, and if they are in our program with the City ID and they are verified with whatever ID that they last had, and I'm having that on the documentation, for the time being, I have to stay on them to make sure that they get their state ID, though, is that they were willing to employ them until they get their information. Now, there's a lot of stuff that they have to work out and do all that stuff, but at least we can get them employment until we can get their information and get it correctly, and so that they can be on all the tax stuff that's needed to be done. So.
Reese's is a huge national company. They're a major employer in our community. We have the same relationship with our local job placement agencies, day labor services here in town, that will accept our City ID while they're waiting for everything else to get taken care of so they can have some sort of income.
Awesome, thank you. Our next question: would our panelists, would you be open for a site visit to see firsthand how this is operating?
I mean, I am. I think one of the easiest things that you can do as far as seeing most of the nuts and bolts is make sure it's on a Tuesday or a Thursday, and the request a ride along at the police department with either Officer Razo or I, and we have the fluidity in our schedule to take you around all these different things that we're doing. But Tuesdays and Thursdays is what MAP is. And I don't want you here if you're not going to that, because that is truly where everything started for us.
Awesome. Yeah. Okay. Then social workers were mentioned earlier as part of the co-response. Are they embedded as employees of another agency or employed by the PD?
Both. So we have an MOU. Somebody mentioned that earlier, a memorandum of understanding with Vallejo, our local contracted community health center. Basically how it works is the city pays the salary of the co-responder, the master's level social worker, but they are employed and supervised by Vallejo. Obviously, you got to be a social worker to supervise a social worker, and I don't have that within me. We also pay a percentage of the salary for what we call the CIT coordinator, and that person is my partner, my equal at Vallejo. So I supervise the law enforcement side of that program, and she supervises the social worker part of that program. If need be, we also head out on the street and take calls as well. So she takes care of all the supervision requirements. I'm not even going to pretend to know how that works, but I know that I can't do it, and she's fantastic at it. But yes, so we pay the salary, they provide the employee and the benefits and all the training and the supervision.
Awesome. We're coming very close to the end, so we're just going to quickly finalize these last questions. We had a follow-up question about clients being informed of their data being made available to police. Wanted to clarify, is there an initial information release or approval from the client to allow law enforcement to access their information? They're signing off on that? How's that working?
Yeah, so we, it depends upon if it's an encampment and we're at the location. We have the notices and the information that is given to them either in a handout or verbally given to them. It also says in there that if they don't wish to have their information in the client track system, that we will not deny services as well. So yeah, we are covering all of that information with them before we are engaging them or entering anything into our system.
I think one of the bigger benefits of that is Razo and I are in the field with them. They know who we are, and we have those relationships with them. Most people will say, I don't care if what people call, they call me Rose. I don't care if Rose and Razo have that. And so, and really that's where it is. It's all about those relationships, but we don't have that come up very often. But if they request your information not be in the system, then we absolutely honor that. We don't have any heartburn over it. It's okay.
Awesome. And our last question here, are there any departments in Georgia? So this is specific to, city of Topeka in Kansas, right?
Yeah. I can't speak for Georgia, but you can absolutely call those local agencies that you might be interested in and see if they have something like this going or if they're interested in starting something. Mrs. Stoller, maybe you can spread some of the information you learned today. The state ID program, I don't recall. We've answered a lot of different questions about people requesting how to do the city ID program. I'm not sure who all has implemented that or what roadblocks they've run into. We're absolutely always willing to help share that program.
And speaking of, we will, again, like I mentioned, we're going to be sending out the slides and the recording, and as well, we're working on further work with the case study that we're working with you guys for. So we'll be able to have a little bit more of that information as well. That if you want to sign up for more info, follow our newsletter, etc., we'll be able to get that to you as well. I want to thank everyone for being here, and I want to thank our amazing panelists. You guys did an awesome job, and we appreciate you spending the time with us and helping us understand your amazing work and what you guys have been doing. Any other questions you guys might have? We're going to, like I mentioned, when we send out the follow-up email with the recording, you can we'll have a call to action there where we'll give you an address to access for more information. And feel free to reach out to that. And any other questions you guys might have, please remember them because we'd love to be able to answer them. Thanks once again, and hope you all have a wonderful afternoon.
Thank you so much.
Thank you.
Thank you for the opportunity, guys.